This is the chest OMT exam. I'm going to start by doing a seated style screen. I'm looking for any restriction, especially focusing on the thoracic region if the patient is having chest pain. The patient feels restricted here on the right side in the upper thoracic area. So I'm going to localize that segment. Okay, go ahead and touch your chin to your chest. And come back up and lean back. Okay, so this patient is flexed, rotated right, and side bended right at the T2 segment. So in order to treat him, I'll use the stylus technique. And to explain this to the patient, I would say you have an area on this right side of your back that feels very tight and restricted. So what I'm going to do is move your head and neck into a position where this area feels softer. Then I'll apply a downward force and swing your head in an arc. And then I'm looking for some of this tightness and restriction to hopefully resolve. So in order to treat the patient, I monitor at that segment, and then I'll flex, rotate, and side bend his head to the right, apply a compressive force, and swing it in an arc. And the arc will swing towards the restrictive barrier. And then once I'm done, I'll reassess by doing a style screen on both sides, looking for less restriction in the upper thoracic region. Next, I'm going to have the patient turn around, sitting up, and we're going to assess the first rib. So what I'll do is I'll palpate the first rib here, making sure I'm up here in the supraclavicular space. Ask him to take a deep breath in and out. Okay. This rib here on the first rib here on the right side is restricted in motion. So I will explain to the patient that the first rib here is not moving well. So I want to use a technique known as the styles technique. And I will have you bend your arm and move it up here. And I'll apply a downward force, and then we'll move your arm kind of in a circle, and this should relieve some of that restriction in the first rib. So in order to treat the patient, I keep the ipsilateral hand on the ipsilateral side, and I'll bend his arm at the elbow, and bring his elbow up into the plane of the first rib, and apply a downward compressive force, and then I'll swing the arm in an arc through the restrictive barrier and have him relax. And then I'll reassess by having him take a deep breath in and out while I'm palpating the first ribs. And I'm looking for that first rib on the right side to move more freely. And then finally, I'll have the patient lie down with his head facing the side. And just scoot down on the table a little bit. And then finally, I will place my hands underneath the patient, having the pads of my fingers anteriorly into the patient's ribs. Go ahead and lay back and relax. And I'll hold this here for a few seconds, and I'll relax, and I'll move down and do it again. And by doing this, we are reducing the sympathetic input to the body, and this can be beneficial, especially if the patient is having chest pain.